Pregnancy confers a state of insulin resistance and hyperinsulinemia that may predispose some women to develop diabetes. Kampman et al. 2015 stated that GDM is one of the most common complications of pregnancy and has been associated with adverse outcomes such as high risk for pregnancy and delivery complications. Therefore, a routine screening for GDM is recommended. Several risk factors are associated with the development of GDM. The most common risk factors include history of macrosomia, PCOS, hypertension, family history of diabetes, obesity, and history of GDM in previous pregnancy. Gowin and Danhich 2017 reported that last 2015, it is estimated that 20.9 million had some form of hyperglycemia in pregnancy. An estimated 85% were due to gestational diabetes and 15% due to diabetes detected prior to pregnancy. There is a lack of agreement with how women are screened and diagnosed with GTM. Different societies' guidelines differ in the following issues: selective or universal, optimal time for screening, appropriate tests, and cutoff values. Philippine Obstetrics and Gynecology Society Clinical Practice Guideline 2011 algorithm for the diagnosis of DM in pregnancy stated that FBS or fasting blood glucose of 92 to 125 mg per deciliter is already considered as GDM and no further test is needed. Currently, the method of investigation for GDM requires frequent invasive pricking process and withdrawing of blood samples, which causes discomfort and it is psychologically traumatic to our patient. Therefore, a much simpler and non-invasive technique for the diagnosis and monitoring of diabetes is very desirable to the patient.